So we're able to not only tell them what the prices are, and they can make a choice. Do you want to pay $1,000 or do you want to pay $75? And that's a no-brainer. But that's the kind of thing that they're hoping that all providers will have to do. So now you're going to have to really understand the difference between a generic and a brand name versus, well, I want my insurance to pay for a brand name because I deserve it. Now you're going to have to make that decision based on real knowledge as to what the difference is and what you're willing to pay for it. One problem I know in hospitals is with hip surgery is that there's about 5 or 6 different types of hip prosthesis, and one's more expensive than the other, and insurance companies are saying we're going to pay the cheaper one, the patient wants the more expensive one. Why? Well, see, these things are never talked about, and so under this new transparency, hopefully the idea is that people are going to have to make their own decisions, and at the same time being told what the difference is in price and why. We just talked about the fact that consumers don't have information about doctors. They don't know when they walk in the doctor's background. I mean, sure, you can go on the website and get that information, but generally speaking, it's an unknown as far as the experience of that doctor, what types of patients that he treats. Is he respected among his colleagues? So those kinds of things are really not known to the patient. Same thing about a hospital. Everybody thinks that maybe Stanford University has a great hospital. Why? Well, because it's a great university. Well, what about certain procedures that are done at Sequoia Hospital that maybe they have more experience with? So those kinds of issues really need to be addressed to the consumer, which are not really readily available to them. There's some ideas that hospitals need to report how many heart surgeries they do or how many hysterectomies they do and how many complications they have. But that information really is very, very small in comparison to the number of patients that really need to be aware of what this insurance plans. When we get insurance through our employers, we really don't know what's covered until we show up at the doctor's office or the hospital and they say, nope, you have a $20 copay or $10 copay, or guess what? You have a big deductible. So all these things are unknown to the patient until they actually need the services. The cost of things, again, that's number one. We don't know what it costs to do a blood test or an x-ray or an MRI. We just get the bill. Outcomes, again, what is the best surgery for me for this particular condition, or the best medication, and why? Patients just take it for granted that whatever is prescribed is going to work in their favor, and obviously if they have a complication, that leads to dissatisfaction and unfortunately sometimes lawsuits. But if you as a consumer now know ahead of time, then you're going to be more responsible in terms of what's expected from that particular treatment or operation. So currently in the system we have a third party paying the bill, we have a third party processing and administrating the bill, and we have a third party overseeing whether or not that treatment should be allowed or disallowed. Supposedly these three things, because we place the burden on the whole health care delivery system on somebody else, this is supposedly the reason why we have generalized bad health and high costs. One of the things that I heard at the health insurance conference was that maybe we should allow an individual person who wants to buy their insurance a tax deduction just like if your employer paid for it. So that's very strange, because insurance companies really don't like to do that because they want a lot of bodies in that insurance plan to absorb the risk. So you won't have people that are sick saying, okay, I want insurance tomorrow. How do we make it a little bit easier then for the insurance companies to swallow this problem? Well, maybe we should allow individuals to buy insurance through being a member of Wells Fargo banking system, or another group. any organization that has an interest, even a book club or a high school or a membership. See, so in other words, you have groups now forming that aren't necessarily employment groups, but they're groups that bring in people of all ages, and that will allow the premium now to be affordable for an individual. One other issue about individuals buying an insurance plan for insurance companies is that it's more expensive to sign one person up than to sign up a whole company. So that way, if a person joins any kind of an association, you have that savings again to the insurance company. So increased competition among groups, eliminating the problem of the pre-existing condition, and decreasing administrative costs is a concept for saving money. We're having a lot of new plans come out where the individuals now are going to possibly, who are getting insurance now through their employers, are going to possibly be getting money that is not a part of the insurance premium, but let's say $1,500 for the year as contributing from the employer, and they're telling the employee, use this $1,500 and go out and buy yourself some health care when you need it. And only use the insurance if you're really, really sick or need an operation or need to go to the hospital or an emergency. So that's the concept. That's the basic concept of consumer-driven health care. And what they're saying is that instead of having a premium of, let's say, $5,000 a year for an employee, they'll give the employee $1,500 and buy only a $2,000 catastrophic insurance plan. See, so that really saves the employer money overall, and now the employee has money in an account that he can only use for health care. That's it. So if he doesn't use it, then possibly that could be used for his retirement. But that money has to be used for health care during the year first. So obviously, if you have people now walking around with cash in their pockets, you think that the providers now will start looking at lowering their price and attracting those individuals. And because the insurance companies aren't paying for the first time you go to the doctor or you need a blood test or a physical, then the insurance premium is obviously going to come down. That's the goal. That's the concept. What do we have to do as patients, as consumers? We have to start learning more about what's good health and what's bad health, what's diabetes, what's hypertension, how can we prevent it. We have to start self-monitoring, which means checking that blood pressure, checking our weight. In other words, taking this seriously now, because now we have the dollars in our pockets, and that's going to be very important how we spend that money. And so we're only going to know where to go if we know where we're at from the point of view of health status. And self-accountability is a very important thing because you know if you're eating wrong or if you're gaining weight. So we see all of a sudden now the responsibility is shifting toward the individual consumer. And that's a new concept because remember, the current system now, it doesn't matter what you do with your health personally. If you're insured or the government and welfare, the government pays for it. And it's really interesting because one of the observations I have is that people, when they have somebody else paying for their care, really abuse the system in terms of what they're expecting the system to provide for them. In other words, I want my diabetes under control, but that doesn't mean I have to do anything about it personally. And so under this model where you're paying out of your pocket for your dollars, all of a sudden you're responsible for keeping your costs lower by behaving in more acceptable health behaviors. So you know how you're supposed to go to your general practitioner for an insurance company before you go see a specialist? Well, now you become your own personal gatekeeper, and you decide when you're going to go and what you're going to pay.